Hello, everybody, and welcome to this episode of Pharmacy in Flux. We're glad to have you on board. I'm Derek DeRosa, your host, along with my co-host, Phil Hauser, and we have two wonderful guests with us today, and I'm going to introduce them both to you. First guest is Saira Mithani. Dr. Saira Mithani, she completed her undergraduate degree in pharmacy at the University of Manitoba. We won't hold that against her here in BC. There's lots of prairie pharmacists in BC. And then she joined Vancouver General Hospital, where she completed her pharmacy hospital residency. And following this, she went on to receive her Doctor of Pharmacy designation at the University of British Columbia as well. And she's the founder of Integrated Wellness Medical Center in Well, along with her husband, owns two pharmacies in the Greater Vancouver Lower Mainland area. And our other guest is Phil Hauser. And no, I'm not making a mistake. This is Phil Hauser squared today. So my co-host is Phil Hauser, but our guest is also Phil Hauser. Phil, our guest, graduated from the University of Brighton with a master's degree in pharmacy, and he worked alongside his parents, who owned the Hauser Pharmacy in Dunnville, which was the original family business since 1980. And Phil took over ownership of that business in 2007. And he now owns three pharmacies in Ontario: the original Dunnville Pharmacy, a second location in the St. Catharines Hospital, and that opened in 2013, and then their newest location in Hamilton, which I think just opened fairly recently. And so welcome aboard, Saira and Phil. Glad to have you here for our discussion today. Our topic today is really a follow-up to Pharmacy in Flux episode number 2, where we interviewed a couple of local BC pharmacists about how they were coping with the COVID-19 pandemic from a pharmacy perspective, and the kinds of things that they had to deal with that were new to them, the kinds of precautions they were taking in their pharmacy, and how their staff and customers were dealing with it. And now that we're at a point here where we're starting to see different jurisdictions across the country opening up the economy a little bit, and expanding into allowing people to expand their social bubble. We wanted to have another conversation as a follow-up to that first one with a couple of pharmacists who can give us some perspectives on where they see things going in the future. You know, what is the new normal going to look like from a pharmacy's perspective? And so with that, I'm going to turn it over to my co-host, Phil Hauser, to start with our interview questions and bring our two guests into the fold here. Phil?
Great. Thanks, Derek. And thanks both Phil and Saira for joining us today. You know, going back to when this all began, what initial adaptations did you introduce in your pharmacies when the pandemic began? Maybe Saira, I'll let you start first.
Well, when it started pretty quickly. It was like one day you had heard about the pandemic, and then boom, the next day things need to be changed in the pharmacy. So the first implementation was quite quickly. The very first thing we did was we just restricted the movement of people into the pharmacy. We're beside a medical clinic, and the medical clinic was actually closed that day. So physicians started working from home. So immediately we just put up signs saying one person in the store at a time. If you're sick, don't come in. We didn't allow people in with family members. So if there was a family of 4, we'd allow one person in. And that was the biggest sort of implementation, or biggest thing that made me realize, oh my God, this is bigger than just like a H1N1 kind of situation.
Phil, what about you? What was the initial adaptations you made when this began?
Well, I'd echo some of those comments. It was a little bit of the wild, wild west, I think, in terms of a lot of us have not gone through this before. So what changes did we need to make? What was a rational change? What was a knee-jerk reaction to some of the information or the propaganda that was out there? And I think for a lot of us, it was a bit of hit and miss. We were taking cues from the public, taking cues from our provincial organizations, and had definitive information as to what to do. So from our perspective, we wanted to try and implement what we consider to be best practices from an antimicrobial control, and very, very much the same. We limited the number of patients that we had in the store at any particular time, and that was across the different stores. In our hospital pharmacy, of course, we were subject to the world around us, or the environment around us, and that was For me, they were taking a very conservative approach, and that was probably the right approach to take at the time. And I think as things progressed, of course, we learned a little bit more and were able to do a little bit more, but limiting exposure. And I think, a pharmacist's role in disease state management or medication management, and I think even within the healthcare system, really much or very much pivots around the role of delivering education. And patients and clients were looking to us to be able to access that and say, what am I supposed to do in these situations? I know I can't go into home hardware. I know I'm having trouble going into the grocery store. But what really is rational here? So a lot of what we did to adapt was be able to provide that education in different ways, shapes, and forms. So whether it be extending our delivery services, whether it be providing different avenues for people to interact with the pharmacist, those were kind of our initial outreaches, because we knew that the demand for our services was not going to collapse. In fact, it was probably going to get significantly worse in terms of the strain on the resources that we had available. So limiting supplies and taking stock of what we could control was key for us to kind of get through.
So, did either of you take it beyond those measures as time went on and implement additional physical changes to the pharmacy in terms of either workflow, plexiglass barriers, markings on the floor for traffic flow direction or social distancing and those kinds of things as well, Phil?
From our perspective, I think each store was treated a little bit differently, and we had to consider the patient sets that we were dealing with. So with our Dunnville location, we had to have some adaptations for certain clientele that maybe weren't going to conform to what we had considered to be our normal protocols, but limiting patients and then having screening tools in place was probably our biggest change. A lot of our staff as well had the option of kind of putting on as much PPE or as they felt they needed to be safe. And certainly we had staff that were exposed at home to vulnerable populations, or what we consider to be vulnerable populations. And we had to take that into account as well. So I think from our perspective, we tried to adapt, one, to the needs of our patients and then the needs of our staff. So was it a little bit of a blanket statement that we brought across the organization? Absolutely not. We wanted to bring that customized care that we're known for in regular times to this reaction as well.
How about you, Saira? Anything like that in your pharmacies?
Yeah, so from a patient perspective, we, of course, we put in the plexiglass, which was pretty much, I think, almost mandatory for pharmacies in BC. And what we did was we looked at a couple different options, and we found that the plexiglass provided a little bit too much of a barrier for our patient contact. So we ended up hanging the plexiglass from the ceiling. So it's like we have plexiglass coming down and then an opening at the bottom for us to interact with patients and put medications through. Yeah. It looks a little bit cleaner in our stores, so it's very clear, so you can't always tell that it's there. So it's a nice way to keep us safe without feeling like it's a huge barrier between patient and staff. From a staffing perspective, it was a very interesting situation. I mean, trying to keep people social distance in a pharmacy is pretty much impossible. So what we did as much as we could, everybody had their own phone, everybody had their own workstation. But interestingly enough, it was almost like an isolation of a family, right? Because you see these people for 8, 9, 10 hours a day. So they are, in essence, you see them as much as you see your family. So what our staff did was we were really cognizant of our exposures outside of the pharmacy as well. So anybody that they were exposed to, we were exposed to too, because there's no way of not, touching a bottle that's your technician has touched, or when you give out medication. Yeah. Multiple people touch the medications. So we really sat down and tried to limit our staff's exposure, not only within the pharmacy, but outside of the pharmacy when they were coming into the pharmacy. So when Bonnie Henry was saying, isolate with your bubble of a family, we had the bubble of a family at home, plus our little bubble of a family within the pharmacy. So it was quite a unique experience for sure.
Indeed,
On
indeed.
that, yeah, on that note, and Sarah, maybe you could answer first. How did your staff adapt mentally to all these changes? Was it stressful? Was it easy? How did they manage all of that?
I think it was initially there was a lot of concern, and like I said, it's funny because we're beside a medical clinic, and when the medical clinic closed, the reality is people when they're anxious, although doctors are allowing patients to see them over the phone or through video chat, people like to be seen and heard face to face. So interestingly enough, we had an influx of people coming in because they just wanted that contact, be it for, if they had high blood pressure or, acne or cut on their hand, and they'd call their doctor and do an online conference, but it wasn't quite enough to quell their fears. So we had a lot of people coming in just to show us, hey, this is the cut, the doctor prescribed this is the prescription, is it okay? So, funnily enough, we had probably more influx of patients as opposed to a decline because of that disconnect from their family docs. So I think that brought about a little bit of anxiety with our staff because there were so many people coming in. But I mean, we have protocols in place. We sanitize every hour. We wipe down the pin pads every time someone uses it. We wash our hands pretty much every hour, or whenever someone comes in with a sniffle, we all run to the bathroom and wash our hands. But now it's like a new norm. So what was quite a panic 2 months ago, it's just our normal reality now. So it's just our habit.
Phil, how about
Yeah.
your staff? How
And
did they adapt to all these changes?
Well, as we talked about before, it's not something that any of us have been through before. So I think there were varying or a wide variety of reactions, and we had some staff that, as I mentioned, because of the vulnerable populations they were exposed to at home, were not comfortable kind of continue on, and we wanted to make sure that we adapted there. We changed shifts for some of our staff to make sure that we had some, I don't want to say alone time, but some isolation points, so that if we did have any outbreaks or whatnot, we had to consider that one shift might entirely be quarantined for a couple of weeks. But overall, I would say that the initial stress and the unknown was probably more significant in terms of the mental health on my staff compared to later on, or even today, where, as Sarah, as you pointed out, that when physicians' offices were closing and pharmacies kind of left standing, my teams seemed to rally around that, recognizing that we were there in a time of crisis, that the idea of an essential worker, and in pharmacy, maybe we sometimes are not necessarily considered to be frontline workers because we're not dealing with acute cases, but this non-urgent primary care that pharmacy delivers, I think really hit home with staff, and they recognize they're important within their community, and they recognize that not only were they lucky to continue to be able to go to work, kind of thing like that, but the work that they were doing was considered to be something of value, and I think that for them reinforced the idea that we will make it through some of what we considered to be hardships at the time.
excellent. So let's take that to the next step before we start talking about the future and what that might look like, and sort of maybe finish off what it was like from the patient's perspective. So, how did what were the most common kinds of concerns of your clients initially? Like, were they concerned about contracting COVID themselves? Were they concerned about getting their prescriptions filled? Or were they concerned about where do I get information? Are you a good source of information, or can you direct me to good information? What were their kind of main concerns, especially in the initial days? And presumably those have changed over the course of the last 12 weeks. But how about you, Saira, starting with that one?
So we did receive some calls for, people with coughs and colds and that type of thing. Not very common because I think the government did a really good job of, getting the 811 out there, message out there, and other resources. The most common problem was patients were worried about getting their medication. when this first hit, we were slammed, as I think most other pharmacies across the country were slammed those first few weeks. And there was difficulty procuring medications, and that message got out to the public. So that was the most common problem. People were calling in and saying, I got my prescription a month ago, but I want another 3-month supply, or can I get a year supply just in case? So managing those kinds of expectations was probably our biggest challenge in those early days. It's since then we've sort of gone more even keel, and for the most part, the shorts are just back to the way they used to be. Apart from things like inhalers and Ventolin and things like that, which we are still rationing. But that was a big fear for patients coming in initially.
Yeah, I can imagine. How about you, Phil?
I would echo that. Everybody that had an inhaler or a prescription for an inhaler in the last 4 years seemingly wanted a refill all at the same time, and with good cause, right? The concerns for pulmonary complications was pretty high in initial stages. So there was a little bit of panic and tempering people. It's kind of like when the ship is going down and you're asking everybody to be calm because it's going to be better if they're calm, but you know full well that trying to rationalize the current situation is very difficult. So there was an element to that where we as pharmacists probably didn't know what was going to be around the corner and what was going to happen with our supply, but we had to put trust and faith in people and procedures that maybe we didn't have a part of or we didn't have a hand in developing. And so I think that was a big risk for us to do. But I mean, one of our biggest complaints that we saw, and this is probably more anecdotal than anything else, was Ontario, our government had limited what we dispensed to a 30-day supply for most maintenance medications. And in those situations, initially there was no kind of catch for the patient to be able to not have 3 fees or for the deductible on 3 dispensing fees. So that was the initial outrage that I think probably we fielded the vast majority of questions on, that nobody wanted to pay extra for their 3-month supply that they would normally get once. But
I think a lot of pharmacists. Yeah, a lot of pharmacists right across the country took a little bit of abuse from patients over that, for sure, and it was a big deal in the media here in British Columbia as well, and unfortunately it was a little bit inflamed because early on, the provincial health officer, Dr. Bonnie Henry, made a statement that her and the Ministry of Health were looking at ways to mitigate that, and essentially led people to believe that the ministry was going to pick up the second and third fees on those, and that never happened. But BC kind of had a really liberal policy, and really what the government said here was, dispense what you think is appropriate based on what you need to do to manage your supply. And if that means giving a 30-day supply to somebody, we're not going to penalize you for doing that in the public drug plan. But if you can give a 90-day supply, we still want you to do that. And I think for the most part, like Saira said, supply chain has gone back to normal. But I think the one thing I want to mention here, which a lot of pharmacists I think oftentimes don't have an appreciation for, is how far back and up and global the supply chain is in the pharmacy world. And the reality is that most pharmaceutical manufacturers get their API, their active pharmaceutical ingredient, really from only 2 major countries in the world that are sources of that API, and it's China and India. And so when manufacturing kind of stopped in China and then the lockdown happened in India, access to API became a real issue. And then there was a lot of stuff going on about countries trying to import medications that they manufactured in a different country without FDA in the U.S. is for approval, or without Health Canada's approval. So, pharmaceutical companies, I should say, in Canada were trying to import medications from European countries and whatnot, where they normally wouldn't have the approval to do that because the manufacturing facility wouldn't have been Health Canada approved or FDA approved. But anyway, nonetheless, just an anecdote there as well to say that the supply chain is very global in the pharmaceutical world, and it doesn't take much to disrupt it. And I think kudos to frontline pharmacists like yourselves for being able to manage it as well as you have for your frontline patients. So let's sort of transition to for the next sort of half of this conversation. What's the future look like? So let's start with you, Phil. Are you seeing and I hate to use these words, but I'm going to because everybody else is, and it's the new cliche, is the new normal, whatever the new normal is. Is the new normal for pharmacy, from your perspective, going to be vastly different from the old normal, or is it going to be a lot like the old normal, or is it going to be the old normal? Are some things going to stick that are different than what we did before? Processes,
Sure.
workflows, things.
And I'd take that question in two parts then. And I guess let's look at our client or our patient facing component of pharmacy. And I think ultimately it's using to overcome the pandemic or the isolation or the restrictions on movement is not new technology. Zoom, GoToMeeting, Skype or FaceTime were around before this all happened, and we've just been able to use and adapt the tools that were there. I think we have to kind of question and say, why were these tools not better utilized before the pandemic? I think that everybody had a pretty poor understanding of antimicrobial control, and I think we've got a much better one now. So will people be a little bit more cautious? Will we see some social anxiety for mass gatherings for the next kind of couple of years? We probably will, and I think that people will have a more cautious approach to the things that they touch and things that they do at the pharmacy level. Maybe a few extra deliveries on a regular basis, but I would imagine that, if this lasts for another 2 to 3 months, we'd probably have more significant and systemic changes. But if for a 3-month period, I would likely think that the vast majority of these behaviors that we've adapted will probably only have, a 10% influence on our future operating components. Going back to the anecdote that you just had in terms of supply chain, that we as pharmacists have to ask, where is our role and responsibility in making sure that we're there for our patients and advocating for them on a much larger scale as well. So if we're looking from a provincial or federal level, what should we be looking for in terms of securing our supply and being able to make sure that healthcare is there for Canadians when they need it, and certainly taking into account these pandemics, as you mentioned on the call, this may not be the last we ever go through, and certainly, in 2006 with SARS, at least in the Toronto area, should have given us a pretty good taste of what could happen. I think from that, where are we going to make those systemic changes to allow pharmacists to be able to have the supply, or to have the supply in reserve to be able to secure what we need in the global marketplace? And whether it's investments in local resources or local drug companies, whether it's going to wholesalers and having certain conditions placed on them, I think there's got to be a bigger conversation that I'm sure will spawn many committees and many hours of conference calls kind of thing. But I think overall we have to look to our future and be ready for it, right?
Yeah, for sure. Before I come to you on that question, Saira, I just want to go back to what you were just saying, Phil, because I think one of the other things that we can do to help manage supply chain issues in the future and avoid the kinds of problems that we maybe saw at the very beginning of this one is to try to educate patients around modifying their behavior, and for them to understand that there isn't a need to panic buy and hoard. And if everybody just maintains their normal buying patterns, we won't run into those kinds of supply chain issues. And if you look at, you've probably all had the same experience as me. If you go into a grocery store, particularly in March or April, of course there was no toilet paper anywhere, but there was lots at the Kruger plant in New Westminster where they make it. There was nothing in the meat section. Everybody's putting on their COVID 15 pounds because the baking section has been decimated. And the same thing happened at the pharmacy level with a lot of prescription medications, right? And I think if we can do something to try to modify consumer behavior for them to understand that they don't need to worry about that, we'll worry about managing the supply chain for them. They just need to get their refills and get their prescriptions filled like they normally would. And that will make sure that the supply chain is in place to be able to serve as many clients as possible and make sure everybody has their medication so we don't have to deal with changes and that sort of stuff. So, Saira, how about you? What's your sort of view of what might stick, what might change? What does the future look like for you and your businesses going forward?
So in my mind, from the profession of pharmacy, I think there's two big positives that have come out of this whole situation. One is, I think we've identified that although we talk about disaster planning and what we're going to do if something hits, we've never really had the opportunity to experience it. So I think it's really opened our eyes to be more prepared in general for the next catastrophe, be it a flu, another corona type of virus, or in BC, an earthquake, or something that's going to really play with the way the world works in our environments. So I think when this is a little bit more stable, I think we all need to just catch our breath and really figure out a plan that works not only at the pharmacy level, but at the provincial level to make sure we have the tools in place when that disaster hits to be a little bit more prepared. Be it, when you hear a whiff of something coming down the pipeline, stock up on masks, stock up on gowns and gloves, start manufacturing your hand sanitizer a little bit earlier in the process than we have this time around. So I think if this is sort of as a dry run for the next big disaster, I don't know if that's too pessimistic, but
No,
that's sort of the way I think of it. But even more positive, I think what this has shown us is we truly are frontline healthcare workers. And for people that don't have an acute issue, we are the people that people are coming to. If you can only talk to your doctor by phone, like I said, people like to come in and be seen and heard. And maybe this is a good push for us to do, prescriptions for minor disease states that's coming down the pipeline in some provinces. But maybe this is the turning point that we need for the government and the powers that be to recognize that we are in that role, that we can take on that responsibility. And we've shown in this initial outbreak that we've stepped up and filled part of that role.
Yeah, I couldn't agree more with you on that. Phil's weighing in on that too. And one of the frustrations that I personally as a pharmacist have had through all of this is the lack of recognition as pharmacists in community, as frontline healthcare workers. You go on the news and you listen to the provincial medical health officers right across the country, and they're laying out kudos for, first responders and doctors and nurses and floor cleaners and food service prep people and grocery store workers, and nobody mentions pharmacists ever. And I think, part of the conundrum there for us is that a lot of politicians and a lot of bureaucrats view community pharmacy as part of the retail world, not so much as part of the healthcare world. And that's really something that in my almost 40 years in this business, we've been struggling with. And it's time to change, but we keep getting these challenges like this pandemic has presented to us, and it gives us an opportunity to really show that we can step up. So Phil, do you want to sort of take this to the?
Yeah, I remember with the essential workers toy line. I was excited because I thought, hey, we're going to be there, kind of thing like that. But unfortunately, we got missed in the
I saw. Yeah, I saw that the little people thing. I thought, there's no pharmacist in here. There's everybody else. But anyway,
no.
I'm going to ask my co-host Phil Hauser to weigh in on the next question. Oh, sorry, Saira. Did you have something to add?
Yeah, I was just going to say, I always feel that pharmacists have middle child syndrome. Like, we're the ones in the middle that kind of do all the work. We're not the older sibling that gets all the kudos, and, we're not the younger sibling that gets all the, attention. We're that middle child. And I think we need to do something as a profession to band together and move to that, top sibling role.
Yeah, for sure.
Absolutely. So, again, everything you guys have expressed today just again reinforces the fact that pharmacists are the most accessible and most trusted healthcare professionals out there. That reality has been around for a long time and will continue. But as you guys have expressed, the recognition just isn't there. One final question from me today, and we talked about the professional side of what you do. Is there any changes in the way you do business, the business side of this, that you see changing going forward, or do you think that will remain the same? Saira, why don't we start with you?
Yeah, that's a tough one. I mean, I think from our perspective, I know there was an interview with BCPHA a while ago where whoever they were interviewing said, pharmacies during the pandemic will offer across the board deliveries And there's something else they mentioned, but I thought to myself, we're not a business model that would do something like that. Like, we don't do free deliveries. We just don't have the capacity. So we had people calling in for stuff like that. And I really thought long and hard about implementing that at our store. And what I found was we'd rather offer that value added service, that extra bit of reassurance. So I think the way our business model is going to change a little bit is we're going to spend even more time on that patient contact, that patient counseling, those follow-ups to make sure that continuity of care is there, even when people can't get in to see their doctors. From a pure distribution point of view, I think things will probably return to pretty much pre-COVID.
Okay. Yeah. Phil, your thoughts from the business side?
Well, I think adaptations really added on, and who is going to bear those extra costs? I mean, from a pharmacist, just wrap it into usual and customary fee and expect that this is now something that, just continually drives down the margins in pharmacy. We're in a privileged position to be essential work, but also in an economic opportunity marketplace with our with a lot of major players and stakeholders that also define what we're able to kind of do with our mix, I guess. And I think that adding these extra costs is an extra burden, and we've got to find a way to be able to deliver the same amount of care for now a little bit more extra costs borne by somebody other than ourselves. So how is that going to change? I can see that we'll have more delivery. Maybe it's a stronger move from the brick and mortar component of pharmacy and online movement, but traditionally, I think that the need to see a the presence of a proper care is somebody valued. So as long as I think. But there's got to be savings, or there's got to be money that comes from somewhere to be able to do it. And I hope that, and part of us getting out of the middle child syndrome is that advocacy component where the governments that are out there, or the governments of the day, recognize the value of what we do. And certainly I would love to see, right across the board, or some consistency across, all of our colleagues from all provinces, so that we could be defined profession in that regard, and not subject to kind of retail market forces, allowing us to be more professional and maybe less dependent, rather than situations like this where if we're forced to bear the costs, the extra burdens, I guess, from this kind of thing, retail will be the signs to that if the governments don't step up. And that's a scary place to put a profession.
Yeah. Indeed, for sure. It's probably a good place to wrap it up, but I'm going to actually ask you each to give me just 30-second thoughts on the approaching flu season. So I know it's only June, but before we know it, it's going to be September, October. We're going to be into our normal flu season. We probably won't have a COVID vaccine at that point yet, but maybe early in the new year, next year. But do you see flu season looking significantly different this year, just from the perspective of managing things like having proper PPE for your staff and social distancing with patients? And it occurs to me that pharmacists administering flu vaccines this year is going to be a lot more labor intensive than ever has been in the past. And does pharmacy have the wherewithal to absorb the associated costs with what I think might happen? So, Saira, how about you on that?
Gee, that's a tough one. I mean, I've been thinking about that too, and I think there's many facets to doing the flu shots this year. There's a lot more awareness for vaccines in general, so I think that the uptake of flu vaccines is going to be significantly higher this time around. The whole thing about PPE, I mean, we're not in the government's plan to be essential workers to get that designated PPE. So if that doesn't change, do we bear that burden and that cost of getting the PPE for our staff to ensure that they can inject safely? And what does that look like? Does that just look like face masks, gowns, gloves, or do we get the face shields? How often do we change them? So I think I'm very concerned about the way the flu shots are going to go this year. I'm not sure if it's the burden, the way the model is right now and the remuneration we get. I don't think it's something that's totally feasible for our pharmacy staff to do at this point, unless the government rolls out something a little bit more in depth and comprehensive for us to abide by.
Great, thanks. And Phil, how about you on that?
Yeah, I look at the clinical concerns, and I say, do we even know that giving somebody the flu shot this round is going to be a good idea with COVID that could potentially still be out there? And what are the impacts on that sets when we identify, the over 65s or the vulnerable populations that should get their flu shot? If we're taking away immunity for retirement homes or group homes that tend to be epicenters for outbreaks, we could be doing so. I think that I'd hate to say that we look to Australia's lead because they always seem to be at the forefront of the flu season, but certainly have to look long and hard at what those actual protocols are and the value of the vaccine. Personally, I believe in vaccines and their benefit with things. The measurement of how much COVID remains a viable threat to these populations is going to be a huge consideration for our ability to implement any kind of program on a wide scale.
Terrific. Well, thanks very much for your input today. I think we're going to have to wrap it up there, but I think it's been a very insightful conversation and gives us some sense of your thoughts around what it's been like and what it's maybe going to be like going down the road in the future and how your businesses might change. I think I heard a lot of from the summary perspective of maybe making better use of technology to connect with patients going forward. And we've always had that, but why didn't we use it to the extent that we are now? And maybe we should be doing that more of that in the future for sure. And just helping patients deal with their concerns and maybe a little bit of re-education for them as well and whatnot. And then all the staff learnings that have gone on around this that will help us be better prepared to deal with it next time. So thank you again for your input and your insights, and hopefully our audience will have benefited from your wisdom today. I'm going to ask my co-host Phil Hauser to make any closing comments that he'd like on this.
I just want to thank you again both for taking time out of what is a very, very hectic time in our history. To again share your experiences, which, as Derek said, will be a benefit to a lot of the pharmacy professionals who follow pharmacy in flux. So once again, thank you very much.
Thanks for having us.
All right, folks.
Well, thank you.
Yeah,
it's been
a pleasure. So that's it for this episode of Pharmacy in Flux. We hope you've enjoyed it, and we look forward to seeing you again next time. Thanks.